Um, First up, I want to welcome everybody to not only the 11th Annual Idaho Family Caregiver Conference, but to this session right now, Care Coordination, Getting Connected. And I just have to say, wow, what a wonderful introduction and welcome by Dr. Sandra Detheridge with the Boise State University the Center for Study on Aging and the Idaho Caregiver Alliance. And just an extra special shout out to Dr. Marlene Trump for her incredible keynote address. I was saying before, some of you might have joined, that I think I felt every emotion as she was speaking and sharing and introducing us to her mom and her family and her experiences, not only as a professional, but also as a person and as a caregiver. So I want to pull that forward and just say thank you to everybody who is in our session today for the amazing work each of you do as caregivers, and you truly are unsung heroes. And it just is wonderful to get to know people not only in their caregiver identity, but also as people. So we're going to make this session interactive. So again, welcome to Care Coordination, Getting Connected. My name is Mary Malott, and I am the Senior Community Engagement Specialist with Molina Healthcare of Idaho. And along with me is Sandra Detheridge, and our panelists, Jennifer Curry, Nicole Heimbach, and Megan Kelly. So I'm going to take a couple of minutes just to kind of give an overview as to what you can expect during this session today, what our learning objectives are, and also just to again remind you that we want to make this a very interactive session. So after our panelist discussion, we're going to open it up for questions, comments, and any kind of experience that you would like to share. So our session today, Care Coordination, Getting Connected, is going to provide an overview of care coordination, case management from the managed care organization or the insurance organization perspective. Our panelists include care coordinators and case managers from Blue Cross of Idaho, from Molina Healthcare, and from Regence, Blue Cross and Blue Shield. And all of these individuals work day to day with members, with caregivers, with providers, with their own teams. So they truly are subject matter experts, and they have so much experience and expertise working around that care coordination and that case management piece of things. So in our session today, what we're going to cover is the role of the care coordinator. We're going to talk about benefits of developing a trusted relationship with your care coordinator or with those that you are caring for. We're going to talk about how do you access and connect with a care coordinator or a case manager, again, all in that insurance managed care space. And then we're going to talk about HIPAA and protected health information and policies around those pieces and how they intertwine with care coordination and with communication. And again, we will allow time at the end for the questions, comments, your thoughts, on how this information is going to be helpful, any experiences that you have that you'd like to share with us. And then the learning objectives, just based on that overview, the learning objectives, we'd like you to walk away with an understanding or kind of a definition of care coordination from the managed care organization or the insurance perspective. We'd like you to be able to list 2 ways that one can connect with their care coordinator, and then who benefits from care coordination. So that being said, jump ahead here. What I want to do is I first want to introduce our moderators, our panelists, and then from there, we want to get to know you. So depending on your comfort level, I'm going to ask a few questions, and I'm going to ask you to respond to those questions. So again, I'm going to start by introducing our moderators as well as our panelists today. And again, I just want to thank each of you for being here with us and joining this session. So I'm going to start with Sandra Detheridge. And Sandra has been with Blue Cross of Idaho for just over 2 years, and she is on the engagement team for the dual eligible special needs plan. In this role, Sandra is privileged to educate members, providers, Medicare brokers, and the community on the benefits of coordinated care. Sandra landed in the human service field accidentally after she received or earned her bachelor, her degree in business management. And she began working with people with developmental disabilities. And she happened to stay there for 23 years. She primarily managed Medicaid regulatory compliance and quality assurance for developmental disability, mental health, and a home and community-based waiver service providers. While working in this field, it gave her the passion for independent living initiatives and self-advocacy for people with disabilities. Sandra currently serves on the board of the Transitional Living Center in Idaho Falls and Life Incorporated, a center for independent living in Eastern Idaho. Idaho Falls is what Sandra calls home, and it's been her home for over 40 years. And in Sandra's opinion, it's the best little town on earth. And when she's not working, she loves being in the outdoors in any season, and she especially loves Idaho winters. So welcome, Sandra. And then myself, I'm Mary Malott, and as I said, I'm the Senior Community Engagement Specialist with Molina Healthcare of Idaho. And I earned my Bachelor of Science degree in Sociology from Western Illinois University. And then in 2020, I learned about a program that was new to Boise State called the Value-Based Healthcare Certificate Program. And I was part of the inaugural group or class for that. And I completed that in 2020. It was about a 6-month program. I moved to Boise in 2018 with my husband, Matt. We moved here from Denver, Colorado. And my healthcare career includes community engagement, business development, provider relations, and strategic planning roles, kind of across the healthcare continuum, if you will. So I've worked with hospitals and health systems. I've worked in skilled nursing facilities. I've worked for a long-term acute hospital. I've worked for physician practices, a mobile urgent care, and currently with Molina Healthcare of Idaho, a managed care organization. And then the other exciting thing I'd like to share about my career is I had the fortunate opportunity to be a standardized patient at the Idaho College of Osteopathic Medicine, as well as for a couple sessions at the Idaho State University campus out in Meridian. And basically what that means is myself and my colleagues were given a script, and we followed that script and worked with medical students so that they could learn about real life and practice kind of real life situations, but in a simulated environment. And it was such an awesome experience. And I just feel like it was a great way to give back and help prepare our next generation of medical students. Next, I want to introduce Jennifer Curry. Jennifer is one of our panelists, and Jennifer is with Regence, Blue Cross, and Blue Shield. She's the manager of Regence personalized care support team, and she works with providers on identifying individuals who could benefit from care coordination, palliative care, and caregiver support. Jennifer is a person-focused and purpose-driven registered nurse with more than 30 years of experience in healthcare, disease management, care management program development, and palliative care. Establishing a highly effective and collaborative teams is part of Jennifer's philosophy on creating successful outcomes and cultivating relationships across the payer, the provider, the patient spectrum. And she believes in a member-centric approach to care management. Jennifer has been married for more than 30 years. She has 2 adult children and 1 grandchild. And in her spare time, she loves to vacation, camp, and hike on her more than 200-acre plot of land in Idaho that she shares with her husband, her 2 dogs, and her 5 goats. And then next is Nicole Heimbach. And Nicole is with Molina Healthcare of Idaho. And Nicole is the manager of the Medicare and Medicaid coordinated plan, or what we may often refer to as the MMCP plan, case management team. And her team works with members who are part of that dual eligible Medicare Medicaid coordinated plan. Nicole is a licensed master of social work, and she has more than 20 years experience in case and quality management programs. And then Megan Kelly, and Megan is with Blue Cross of Idaho. Megan works as a care coordination manager for Blue Cross of Idaho's dual eligible membership. She's a social worker by trade, and her previous experience includes case management and discharge planning in a geriatric psychiatric inpatient setting, small claims court mediation, and Ada Canyon County court visitor for the adult guardianship situations. In 2014, with the inception of the managed Medicare, Medicaid in the state of Idaho, Megan became a care coordinator for this population. She has been working with Blue Cross of Idaho's dual eligible members ever since. She moved to Idaho in 1996 and has rooted herself in the Treasure Valley. She is married and the mom to two very large and continuously eating teenage boys. And her family recently welcomed the addition of a mini golden doodle. Megan enjoys watching her boys participate in sports, camping with family and friends, and quilting. So based on these introductions, you will see that our panelists who represent the various organizations and who work with members, they have either social work or an RN, background. So when Sandra provides the overview, you'll see how this just becomes so intertwined and is so important. So again, at this time, I'm going to stop. And what I want to do is I want to turn it over to all of you. And I just want to ask you a few questions. So what I would like to do is I would like to launch a poll. And this poll is going to ask 3 questions. And again, if you feel comfortable, answering these, or if you prefer not to answer them in the poll, but you want to put them in the chat, you're more than welcome to do that. But what we really want to get to know is a little bit about you. And the first question is, what describes your role as a caregiver? The second question is, how long have you been a caregiver? And the third is, as a caregiver, have you worked with care coordinators or case managers? So I'm going to launch this poll and just ask you to take a few minutes to complete it if you wish. And if you don't, that's okay. Or if you want to add anything in the chat and just tell us a little bit about yourself, you're more than welcome to do that as well. So our poll should be up, and tell me if you can see it on your screen. It looks like we're having a few people answer the questions. So thank you for answering. Give it just a few more seconds here. Okay, Gloria, thank you for the comment. And we'll be covering how to contact case manager or care coordinator. Okay, so again, thank you for completing this poll. And I'm going to end this now, and then I'm going to share our results. So it looks like most of the folks on here today are family caregivers, and it looks like we have one who responded as a professional caregiver, and then a couple who responded as other. And then how long have you been a caregiver? Oh my goodness. Wow, a lot of folks on here, more than 5 years. And then between 3 and 5 years, and then one person less than a year. So you will be able to share your journey and your experiences if you wish. And then as a caregiver, have you worked with care coordinators or case managers? And it looks like 10 of the 16 people who responded have worked with care managers or care coordinators or case managers. 5 said no, and 1 said not sure. So again, thank you for sharing that information, and that kind of gives us a little bit more information about you. So I'm going to stop sharing here, and at this time, I am going to turn it over to Sandra.
Thank you, Mary. And also welcome everyone. And it's so good to have you guys in our session here on care coordination and case management. And also for your responses to the poll, that helps us out a little bit as we go through this, just knowing the audience that we're speaking to. So I just want to just briefly go over what a care coordinator or a case manager is. And again, we're looking at this from the perspective of the health provider or the health plan provider. And so that care coordinator role or that case manager really is they're an essential part of a member's care team. And of course, that care team is going to be made up of that member, family member, or a legal representative that they might have, caregivers or supports that they have. And then we're also looking at other specialty providers or primary care physicians, just those people that make up that care team for that member. The care coordinator or the case manager is going to be the central point of contact for your health insurance benefits. And really their role is to make sure that a member is getting the right care, that they're getting the information that they need to be able to make healthcare decisions. And they're tasked with working directly with the participant and their families and their healthcare providers. So just really bringing those pieces together and making sure that all of those pieces work together. They're available to come meet in homes, or they're available by phone. They really are trying to be there and available when you have a need. And I think a really important aspect of that care coordination role or care navigator role is just being a support when a member is facing a serious illness or a condition such as cancer, diabetes, or a behavioral health issue. I think a lot of times when you get a diagnosis like that, it's pretty overwhelming, and there are a lot of decisions that have to be made. And that's something that a case manager or care coordinator can assist with. And in addition to just being available to members when they reach out to their care coordinators or their case managers, they also will reach out if they see that there may be some support that's needed. So if, for example, if they're seeing evidence of a chronic condition or gaps in care, if they're seeing that there's multiple ER visits that are happening, or if there's hospital stays, when the care coordinators see that, that gives them an opportunity to be able to reach out to that member and just make sure that nothing's falling through the cracks, that we're providing that comprehensive care for that member. So who are they? Our care management teams, our care coordinators some are social workers, we've got registered nurses, we've got behavioral health specialists, we've got qualified healthcare navigators. So they come from a range of different backgrounds. And of course, that provides some different perspective. One great thing about these care coordinators is that they work in teams. So a lot of times they're able to pull on the experience of other people in their care coordination team if they have questions or issues that they haven't seen before, or that they might need a little bit of guidance on. And I think just to emphasize some of the benefits of that coordinated care. So with the Molina Care Coordination and Blue Cross of Idaho Care Coordination, we're talking about integrating 2 health plans, Medicare and Medicaid benefits. A lot of times these are very confusing. And so care coordinators have the ability to be able to take those two, merge them together and make sure that those are working together. And then the case manager is also just working with the benefits that are provided under those health insurance plans. So with that, you get a comprehensive set of benefits. You get accountability to one entity to coordinate that delivery of services. You have one care management team that's helping you coordinate all of your healthcare benefits. If you think of it as, you know, a lot of people do have multiple health plans, and sometimes if you are looking for some benefit coverage, you might have to go to one health insurance and then go to maybe a secondary healthcare provider or health insurance provider to try and get the coverage that you need. With the care coordination, that care coordinator, that case manager is going to just make sure that that's taken care of without the member having to do a lot of that legwork to make sure that that coverage happens. So just in summary, I would say care coordinators, case managers, they're just going to provide you with the information and the resources that you need. They're going to help you navigate your healthcare benefits. They're going to support the doctor's treatment plans. They provide assistance in making healthcare decisions and really just making sure that you get the most out of your benefits. So next, we're actually going to go through some questions for our panelists. And so I'm going to turn that back over to Mary to go through that.
Okay, can you hear me? Am I? I can't see my picture on here, so I can't tell if I'm on or not. Can you hear me?
Yes.
Okay. Okay. Very good. All right. So we're going to move into, as Sandra said, the panelists and the questions. And you know, again, feel free if you have questions or if you have comments, feel free to put those in the chat. But I'm going to start with the question of. Oops, I'm on the wrong page here. Okay, so we had a question in the chat earlier, and that question was, you know, I'm not sure if somebody in my family has a care coordinator, or you know, if I have had a conversation with that individual. So the first question I'm going to ask of our panelists, and I'm going to start this one with Nicole Heimbach. And Nicole, the question I'm going to start with is, how do members, whether it be Regence, whether it be Blue Cross of Idaho, Molina, or any other insurance plan, how do members and their caregivers or members of their care team benefit from care coordination? And Sandra just kind of walked us through a little bit of that, but I'm wondering if you can, you know, share from, you know, your boots on the ground personal experience. And again, that question is, how do members and caregivers or members of the care team or care companions benefit from care coordination?
Yeah, thanks, Mary. Can you hear me okay?
Yes, yes.
Okay, if dogs start barking in the background, I'm just apologizing up front for that. Okay, so how do members and caregivers benefit? I think that the healthcare system is confusing, and this having a care coordinator or case manager to be your advocate and sort of walk the member and the caregiver through the healthcare system, I think is one of the main benefits. Making sure that you are able to see the providers or you know, even just refer to the providers that you need to see, helping you through what to ask my provider or my doctor, or I've talked to my doctor about this and they're not answering, and just sort of having the care coordinator walk you through that process. I mean, I'm in it. I've been doing this for 20 years and it still is confusing to me sometimes. What is a prior auth? What do I need to get a prior auth on? And those are all the things that care coordinators can help with. They can assist with prescriptions or managing getting your prescriptions. They're really your advocate to, again, help you navigate the healthcare system. They are your central point of contact So they may not have all the answers, but they are able to direct you to others in the organization or even outside the organization to answer your questions. They're available to provide community resources. Maybe your health plan doesn't provide everything that you need, and most likely they don't, but they're able to, with their experience, give you those community resources that may help or meet the needs that you have, and also refer you to other organizations for support, like the Caregiver Alliance, and just so you feel like you have a team, which is another thing that is a really good benefit, is they facilitate that interdisciplinary team. So their role is to sort of collect all of the members of the team, whether it's the provider, the caregiver, family members, a community agency, and sort of this help all of them be involved in the members' care.
Wow, Nicole, thank you. And I'm gonna turn it over to Jennifer. And Jennifer is with Regence, Blue Cross and Blue Shield. And Jennifer, I'm going to ask the same question of you. From your perspective, how do members and caregivers, care team companions, care companions benefit from care coordination and case management?
Well, Nicole did an awesome job of giving an overview of all the things that we do as care managers, case managers. We are here to really connect the member to, I always think of like somebody being a quarterback on a care team. And we kind of are that quarterback at times, like we help kind of carry that ball, and we help connect the member to their PCP or to their specialist, kind of that communication gateway of what's happening, connecting with community resources as well. And also we're kind of here for that support system sometimes as too, because sometimes you just need somebody to talk to and kind of talk through a lot of the frustrations. As Nicole said, the healthcare system and journey navigating that is really, really confusing. And we're just here to listen and kind of take, the day-to-day things that are happening in your lives as members or patients and caregivers, and help simplify that journey a little bit, and provide what we call a care plan or roadmap to getting things done in a timely manner for you, and helping just listen to some of the, your frustrations, and helping kind of get rid of all of those barriers, and provide interventions that are going to help move your healthcare journey along to something better. And sometimes that's like 2 steps forward, 3 steps back. Sometimes it's constantly forward, and sometimes, it's just working through all of that together so that we can help you through that journey. And so we're just kind of here to carry that ball along with your primary care physician. We really do believe that your primary care physician is that person that should be holding the ball as the quarterback. And, we're here to kind of help them through that journey. So, and besides the resources and the education on disease process, offering, quality, improving quality of care, trying to help you figure out where there are gaps, trying to get you connected, all of the things that Nicole said as well.
Okay, thank you, Jennifer, for that perspective. And then I'm going to ask the same question of Megan. And again, Megan, that question is how do members? Megan is with Blue Cross of Idaho, and how do members and caregivers and care companions benefit from care coordination, kind of from your vantage point?
Sure. Thank you, Mary. Yeah, I think, my predecessors, Nicole and Jennifer, really did a great job of explaining it. And I think I would really echo all of the details and the pieces that they shared, and really just highlight the challenge and the complexity of walking through Medicare and Medicaid and getting all those services. It is complex, but it's also ever changing. And so I think that's also the benefit of having the care coordinators there, is that the care coordinators are there through the long journey, through the whole length of that enrollment with the memberships. So when things are changing and healthcare is changing, or something is changing within the member themselves around progression or different needs or fluctuation in needs, that care coordinator is there throughout that healthcare journey, really, just as Nicole and Jennifer said, really walking that walk. And I love the sports football analogy, really kind of taking the ball and passing it along and working within that team with the existing providers, maybe helping to recognize a need or an opportunity for a specialist or a new provider or a community resource, and really just walking alongside with the member and the member's supports throughout their healthcare journey.
Okay, thank you, Megan, for that. And I have to agree. I love the sports analogy, and I think when we think back to this morning, as Dr. Trump was sharing, her experience and her journey, with her mom, and when she showed the video and the picture, of her mom out on the blue, right, with the team, and we have to take into consideration too, that the caregiving is one component of everything that we do day to day, right? It's one piece of things, and as everybody has mentioned thus far, some of the complexities and the challenges and just looking at all of the different pieces of things that not only the member or the beneficiary or the person that's receiving the care is experiencing, but also each of you as caregivers and the many other responsibilities that everybody has day to day. So again, thank you for sharing those from each of your vantage points. I'm going to just pause for a moment because it looks like, let's see. Looks like we have a comment in here. I think I missed the information. Sorry, maybe you answered it. But if I were to help guide someone, how do I communicate with them to find out, how do I communicate to them how to actually find their care coordinator through their insurance agency? Well, that's a perfect question, because that segues right into our next question. And the next question I have for our panelists is, and I'm going to start with Megan with this question, and it is, how does one access and connect with a care coordinator? And so that's the first part of the question. And the second part of the question is, so once that access has taken place and one knows who the care coordinator is, how do care coordinators engage and interact with members and those members, care companions, and members of the care team? So again, Megan, I'm going to start with you on that question.
Okay, sure. So yeah, great question, because I think, like we're saying, care coordination is such a great service. It's a great benefit, but how do we get connected and how do we know who the care coordinators are? Speaking from my vantage point, I would say all of our members can very simply and very conveniently connect with their representative within customer service, call their phone number on their insurance card, and find out who their care coordinator is. I think conversely, our care coordinators are always reaching out to members. So kind of adding to the second piece of the question is, the care coordinators are always available. They're following up with members through right after they're enrolled within our plan, and also throughout very different touch points across their healthcare journey. So really trying to get connected, like we said, with their primary care physician, but maybe they go in for treatment or into the ED, or they have a utilization episode. Our care coordinators are following up on all of those pieces as well. So it truly is a natural and kind of organic way that the care coordinators reach out and connect with members as it relates and is applicable to that specific member's need. So I think, in summary, kind of the touch point is, initially, our care coordinators will reach out to members, but they can also contact the phone number on their insurance card to see who their care coordinator is if that's not known.
Okay. Thank you. And the same question is going to go to Jennifer. And again, Jennifer, Regence, Blue Cross Blue Shield. So it's a slightly different vantage point.
Yeah, and it's kind of the same connection. So it would be the number on the back of your card, and that will put you in touch with our customer service agents. And then they put in a referral to the care management team, and then someone will outreach within, a couple of days, depending, or maybe even a few hours, depending on, what your needs are at that time. And then our care coordinators also reach out after emergency room visits or inpatient visits. We also have people who reach out if you have gaps in care. So if you are due for a colonoscopy or a mammogram, or any of those gaps in care, at that time you can ask whoever's reaching out if you can speak to somebody more in depth if you're having difficulties. The one thing that I will say, and I think we're going to go over barriers later, but the one thing that I will say does get confusing for people is if you've just had a utilization like inpatient or emergency room and you have someone reach out from your insurance company, sometimes that can be confusing for people because you have many people reaching out. Sometimes your provider's reaching out, sometimes we're reaching out, sometimes the hospital's reaching out. And so just clarifying, this is my insurance company or my payer, so that you can kind of keep all of those things separated as people reach out to you. So I think we're going to go through barriers later, but I just kind of wanted to put that plug in on that outreach campaign. We also, not just with high utilizers, but we also reach out proactively with people with new diagnoses of diabetes and cancer and things like that, just to offer that extra layer of support. So.
Okay, great. And thank you, Jennifer, for bringing that up in terms of the quote unquote, the barriers and often having, more than one person, reaching out, and it can get confusing. So we will talk about that in just a little bit. So I'm going to move it over then to Nicole. And again, Nicole, same question. How does one access and connect with a caregiver or care coordinator? I'm sorry. And again, this is kind of from the Molina Healthcare of Idaho vantage point.
Yes, thank you. I will echo what Jennifer and Megan said. We all kind of have the same process. So if you call the number on the back of your Molina card, you can ask for a case manager, and then we get a referral to our teams, and then the case managers will reach out. Some of our lines of business automatically have case managers assigned to them, just based on contract. Some of them don't, and you can ask for one anytime. So if you don't call in and ask for one, then the case managers will proactively reach out. And again, just like Jennifer and Megan said, we will reach out after a hospitalization, after an ER visit, anything where we think there might be a change in condition or the member might just need a little bit more support. We will reach out, but members, caregivers, family members, anyone can always just call the number on the back of the card and be connected with the case manager.
Okay, so a question, I'm just going to add on a question from all of this. So if I'm a new member, how soon or how much time does it usually take, and this may differ from situation to situation, but how much time does it usually take before I have a care coordinator or case manager assigned to my case? Is it a week? Is it 2 weeks? Might it be 30 days? Is there kind of an average amount of time?
Yeah, speaking from the Molina perspective, we assign them as soon as, so we get a list of all the members that are new to us, and so we assign them right away. Because the list is usually longer than a couple of people, then it could take a while. And so so if you are needing help now and you just switched your health plan, you can always call in, and we will just sort of move you to the top, because it is based on risk levels. We try to prioritize those members that might need more help. But if you do need more help, we may not know about it based on what we have. And so if you call in, you will get that phone call a little sooner.
Okay, and Megan and Jennifer, anything you wanted to add to that?
Yeah, I can. We don't, at Regence, we don't automatically assign a care manager to people who are new to plan. We do have customer service calling out during open enrollment to explain benefits of the plan, and that is one benefit that they do explain. And I just want to just echo what Nicole said. A lot of times we don't know if someone is having problems with their health because they're new to our plan, and so we can't necessarily see any of their history. And so it's really important at that time to say, I would like someone to help me because I am having difficulty navigating this journey. I'm new to your plan, and can you have someone call on a regular basis and kind of help me through that? And at that time, they would be assigned a care manager.
Okay, thank you. Thanks for adding that. And Megan, was there anything that you wanted to?
I would just kind of reiterate again the same. We from the Blue Cross of Idaho perspective, we have depending on the line of business, if you will, some of our programs have an assigned case care coordinator upon enrollment, and so that outreach happens very quickly after that member is enrolled. And then with other lines of business, there's available care coordination based off of the awareness of kind of the complexity of the member, as well as a request or a choice to be involved in case management.
Okay, thank you. So the next question I want to ask is around not contacting and connecting. So, during the pandemic, it seems like so much has kind of pivoted, from in-person meetings to either telephone, perhaps like the situation today, via Zoom or, other kind of virtual platforms. How it's sounding so far like a lot of this is done, via telephone. Are there other channels or other avenues that all of you and your teams use to, have that connection and that contact and those conversations with the folks you're working with? And let's see, we'll have Jennifer start the answer to that question.
I knew you were going to call my name somehow. I was ready to unmute. Well, Regence, we do only telephone outreach, and also, email, snail mail, fax. We don't have any in-home caregivers that go in. We utilize benefits for that, home health or community resources for that. So we are all telephone.
Okay, and Megan?
Yeah, so again, so for our dual eligible membership, when we are not in a pandemic COVID situation, we are out in the community. We are out in the community and we visit with members in their homes. So we outreach through the telephone. We have that face-to-face contact, and like you mentioned, in the last 2 years, we've really gotten great at Zoom and some telehealth technologies. So we also try to connect with our members face-to-face through Zoom if we're able to set that up with them as well.
Okay, and I know this pandemic, if you look at some of the things that have come out of it, one is, the ability to, utilize things like Zoom or Teams or, these other virtual kind of live platforms, right?
Right.
And, there's efficiencies, that are there. And, for caregivers, who are taking care of one in the home, it can be challenging, to, get a person, dressed and go out and, all those. So there are efficiencies to it.
Right.
So I'm going to turn it over to Nicole to answer that question as well.
Yeah, so like Megan said, we are out in the field as well. We do face-to-face visits for our dual eligible members. But again, with the pandemic, we had to stop that. So it's been almost 2 years since we've been out in the field. So been a while. So telephonic, and we had some telehealth. We stood up a telehealth platform to try and meet with our members face to face. So at least we could see them, make sure everything was okay. But otherwise, it has all been telephonic, and like Jennifer mentioned, snail mail, some electronic mail, some texting. We will, do just to connect with our members. I mean, especially some people had caregivers, even if they had paid caregivers, that couldn't go into their home anymore. They didn't want them in their home, and so it was important for us to be able to connect with those members who are used to having someone there, and then we're not able to. So we sort of, like everyone, use every means of communication we possibly can to reach them.
Okay, thank you. Thank you for that. So what I want to do now is I kind of want to move over a little bit, and I want to address maybe some of the challenges that our care coordinators and our case managers may experience. And I kind of want to look at it from a couple of different points of view. One, when working with caregivers, or when working with in conversing with people other than the actual member, the insurance beneficiary, if you will, that member, what are some challenges that you face around having those conversations, and around HIPAA and protected health information? Can you talk a little bit about what that looks like, and maybe what kind of documentation or authorization you need in order to be able to have those conversations with folks outside of the actual member of the plan? And again, let's see, I'm just going to randomly, Megan, I'm going to call on you first.
Sure. I think I had that feeling too. You were going to call my name. No, I think that the HIPAA and the privacy confidentiality is it's a detail that we have to always pay attention to. We generally work with the member, or we try to work with the member's authorized representative, and I think how do we ensure that, or what documents do we need? We're looking for a healthcare durable power of attorney, if that if a member has that in place. That's always a great document to have in our records. Some members have guardians, and so if there is a guardianship in place, we really need to have that documentation as well. We also a lot of times recognize that there could be like maybe an informal, if you will, support. So a daughter or granddaughter or aunt or somebody is really involved with our members' care, but there is nothing legal maybe in place. So a lot of times the member will say, hey, can you please talk to my daughter? Can you work with my daughter? And we really focus on having the member be the center and the focus of that conversation, and work with a member and whoever else they choose to be involved with their care.
So with that, is there any kind of special form that needs to be completed, or anything that you need, or is the verbal okay by the member? Is that sufficient?
In every scenario, it can vary and can be different, but we do have a release of information form that we can have the member complete, and they can identify, say, a daughter, and we can work with them on getting that paperwork completed. But if in the moment during a phone call they say, hey, please talk to my daughter, we can speak to the daughter in that scenario as well, because the member gave us that sort of verbal permission at that time. But we would then want to work with the member to get something in place, maybe for next time, if that's what the member chooses.
Mm-hmm. Okay, thank you. And then same question, Nicole.
Yes, very much like Megan, we would also look for the power of attorney, or we at Molina, we have a form we call it the PHI form. And so it's a release that we will send to the member, and they can have whoever they wish to be their representative fill out. And then when we get that back, we put that in a file so that everyone across the company can see it. Because the verbal consent is okay, and we accept that as well, but the verbal consent has to happen every time. So every time we talk to the member, or every time member services talk to the member, or anything like that, they have to give the verbal consent. So the caregiver or family member or whoever can't just call in independently without the member being present. And we can talk to them. We just won't release any, if they're looking for specific personal health information, we won't release that. So there's certain things they can call in. They can request the case manager, even if they're not the power of attorney or the personal health representative, but we wouldn't share any personal health information with them. So it is important to have those documents. But again, verbal consent is just fine, and we will take that.
Okay, thank you, Nicole. And Jennifer, anything you want to add?
You know, pretty much same answer, same documentation. We have something called the HIPAA that we mail out to people. We try at first, of course, verbal consent. As we continue to work with the member, then we'll start sending out that HIPAA information, which you can either email it or send it back to us, and then we also put it in documentation or a chart so that we can see it each time. And then just one more thing that I wanted to add: when we do call people or people call us, we do ask for full name and date of birth, and that can be kind of like, what? Why are you asking that? But it is something that we need in order to talk to people through the Telephone Consumer Protection Act. And so I just want to kind of add that in there because sometimes that can be a little off-putting when that's kind of like our first or second question besides hello, how you doing? So I just want to add that in.
Making sure you have the right person.
Yes.
Right, with just good little nuggets of special information to know that it's actually them that you're speaking with. So thank you, Jennifer, for adding that in as well. And again, I mean, the protective health information, HIPAA, all of these are so important, but it also is equally important, again, to be able to utilize and have conversations with and work with the care coordinators, case managers, and do this in a very, I'm going to use a kind of a technical term, but bi-directional, way where, it's a dialogue, that is happening. So I want to continue on in terms of challenges. What are there any challenges, that you face in terms of that telephonic, connection? Sometimes people have, maybe telephone numbers that are out of the, I'm speaking locally here in Idaho, out of the 208, area code, or if a person has, certain numbers blocked on their phone, or they don't recognize, a telephone number coming through, they may be reluctant to answer that phone. Are there any tips or nuggets or, experiences that you can share, around kind of how to avoid any of those types of situations? And let's see, we will start with Nicole on this one.
I knew it. No, I think that one of the biggest challenges we have, at least Molina, is reaching the members sometimes. We do try several times. We try at different days of the week. We try at different times of the day to try to reach them, as well as we send out letters letting the member know that we're trying to reach them. I think it's what's difficult sometimes is if the member doesn't recognize the number, they don't answer, which I get, I do it too. And so it's hard for us to reach them if they don't answer. And so what we try to do is when we initially speak to them, if we initially speak to them, at least give them the phone number and let them know so that if they call, to put us in their phone so that they recognize that, or our name pops up or something, so that they will answer. These members, and I think it's across all of the managed care organizations, they get a lot of phone calls, and not just from us. They get it from, member services, and they get it from, the people trying to close gaps in care, or your provider, or, there's a lot of phone calls. And so we don't want ours to not be the one that they answer. So if we give them our phone number and really ask them, just make sure they recognize it, or also the other thing we do is schedule a time. Like, I'm going to call you on Tuesday at noon. That's going to be me. So even if they don't recognize the number, maybe they remember that we called. We might ask them to write it down. This is when we're going to call you. So we do have a high instance of people that we cannot reach. And so what we hope is that once they receive the letter, that they will then call in. And we do get a fair amount that do.
Okay, thank you. And Megan, I'm going to ask you the same question.
Mm-hmm. And very, very similar to Nicole and the process she described. We have multiple touch points. Use the snail mail if we need to. Try to connect maybe different times of the day, different days of the week. Try to maybe connect with a provider if we're not connecting with a member. Maybe we know who their provider is, and try to reach them that way, and let the provider know that we are the care coordinator trying to connect the member on that level. And I think really once that connection is made, then yes, the member is then prepared, and they know their care coordinator, and they're waiting for those scheduled phone calls, and they become familiar with that number. But there is a little bit of legwork in getting creative initially in the beginning sometimes.
Mm-hmm. Okay, thank you. And
Mm-hmm.
Jennifer, same question to you.
Yeah, we also do not lack in sending paperwork to people, letters, and calling them. I think that can be a barrier too, is sometimes people are like, what is the most important for me to open? But there are contacts in those letters that we send out, especially if you have just recently been to the ER or inpatient. You're probably going to get a letter saying, we've been trying to contact you and would love if you'd call us if you need extra support. Just some pointers that I would have is just like Megan and Nicole were saying, is programming us into your phone as like your care manager, like Jennifer, care manager, Regence, because you may have a care manager at your provider's office too. And that's also helpful for us, because if we want to do some care coordination or call the care manager at your provider's office, then you have everything ready for us, and can tell us how to contact the other people that are involved in your care. And then the times are important as well, setting up times that are convenient for you to answer the phone. And I saw a question in the chat saying, like, I think my mom and sister may have a care coordinator. How do I really find that out? And it's really great if somebody can say, my care manager, care coordinator is going to call me at 1:00 on Tuesday. Can you be here? Or, like, what would you like me to ask them? Like, what are the things that are you're concerned about that you want answers to? And then I can ask and get answers to that. So
great. And that's another great tip too, Jennifer. Thank you for sharing that. And it looks like we have another comment in here, and that is, thank you all. Thank you all. Sorry, I'm having trouble reading this. I think I need to put on different spectacles. Thank you for all you do to attempt contact with folks. I know working with the senior population, sometimes it's many attempts before contact is made. So again, thank you for that comment, and thank you, Jennifer, Nicole, and Megan, for sharing some of those nuggets, with us on how to keep those lines of communication open. So at this point, what I would like to do is I would like to turn it over to Sandra, and we want to open it up to everybody that is here in the session with us today. to ask any questions that you might have, to share experiences, to let us know, if there are things that were shared today that are helpful and that will be helpful as you continue doing the wonderful work that you're doing in terms of caregiving. So I'm going to turn it over to Sandra at this point. And again, I want to thank Nicole Heimbach and Jennifer Curry and Megan Kelly and your respective organizations for being here today and sharing your time and your expertise with us. So Sandra, it's all yours.
Thank you. And I want to say thank you too to Nicole and Jennifer and Megan. Thank you so much for being here and providing your perspective of care coordination from your respective health plans. In my role with Blue Cross of Idaho, I do get to interact with a lot of members who access that benefit of care coordination. And I just want to say, being around that and being able to hear stories from members, what you guys do is really important. And it's very needed, I think, for people as they go through their healthcare journey. And so just thank you guys for speaking to that today. So we do want to make sure that if you guys have questions that you want to address to the panel, that we get those answered. So we're kind of a small group here. So I would say if you want to unmute yourself and ask a question, feel free. If you feel more comfortable doing it in the chat, certainly feel free to do that as well. And we can make sure that those get answered. And then too, and just speaking to you guys as caregivers, if you want to share experiences that you've had with care coordinators, as you've worked with your members through their healthcare journey, we certainly would be open to hearing that as well.
Looks like we do have one comment in the chat, and this thank you for this information and going over everything. So thank you, Sarah, for being here and joining the session today. So I am just gonna, if I can, I'm just gonna take a moment to share an experience I had, and this was a personal experience just a few days ago, and that is I went in for a test, and then I had somebody when I went in for the test, they said, oh, so-and-so was going to call you, and anyway, I received a call. Well, I happened to be on the phone, so I missed that call, and I didn't receive a voice message or anything, and I tried to call back the number. And when I tried to call back the number, it rang into the main number. So when I was trying to explain why I was calling back, that I hadn't received a message, and this is the number, it became very challenging to try and figure out who it was that actually called me, because this was such a huge system. So I think that, that experience really points back to, the things that Megan, Jennifer, and Nicole, had said, in terms of, putting that information, in your phone, or identifying, who it is that might be calling you, to avoid any kind of frustration. I'm fortunate I was eventually able to get to the person that did call me. They ended up calling me back, later, but we want to do what we can to mitigate, any of those, kind of challenges, and, the idea of playing, phone tag, or other technology tag. So that's just my thought. It looks like there's something else here in the chat.
There, I just mentioned there is a question about. Gloria mentioned her sister has both Medicare and Medicaid, but is not on a dual status insurance. And how would you go about combining the two? So, Gloria, I just want to speak. So there are both Molina and Blue Cross of Idaho. We both have those dual status insurance plans, and I would just encourage you, if you go to the sponsor link through the lobby. Both Molina and Blue Cross of Idaho do have a sponsor link there. So you can actually just go in and talk to somebody about either one of those. I I will say too, and Mary, I'll let you mention. So we do have a website for our dual special needs plan. It's IdahoTrueBlueSNP.com. And then I'm sure Molina has one as well, Mary, if you just want to mention what that is.
We do, and it's Molina Healthcare, MolinaHealthcare.com. And then when you go in there, you can select Idaho, and then you can select the dual eligible plan.
And then there was a question about in-home care and finding if there's anyone or finding someone to work for the wages that she qualifies for. And I don't know, Nicole, Jennifer, or Megan, if you guys, any of you want to speak to in-home care services. And I know that one thing that I hear from our care coordination team is it's just getting more and more difficult to find direct support workers. There is no magic answer. I know that for sure, but I don't, if any of you want to just speak to maybe some of the things that you've seen as you've worked with people who have needed in-home care.
Oh boy, that it's hard. It really is. It's difficult. That statement rings true with all of us. I think I feel I've done hours of making phone calls, trying to find in-home care for people, as well as, you know, suggesting people call 211. I'm sure that you've done all of those things, but 211 will give you services in your area. But some other things that I have done is, and I think that are helpful, and especially because we cover people, we call people from Idaho, Oregon, Washington, and Utah, and I'm in Lewiston, so sometimes I don't exactly know all of the services that are available in Boise, or I guess I know the services, but maybe not circle of friends. So a lot of times I suggest that people like reach out to churches. They reach out to a group of friends or someone who you know has had a caregiver before. And I know that I'm preaching to the choir, right? Like you've probably done all of these things, but those are some of the things that, you know, I will kind of try to track down. And so I think that just knowing if you have a circle or support system, and being able to communicate with that circle or support system within your community, sometimes you can find caregivers through that. But boy, that statement is so correct. And especially with COVID, it has gotten harder and harder to find in-home care for people. And I really empathize with y'all because it is difficult.
I will echo what Jennifer said. It has, the shortage of caregivers is a challenge. I think if you ask any of my case managers, they would say that is the number one challenge right now, is trying to find caregivers for our members that need help. Like Jennifer said, we do contact churches. We put our members on waiting lists on like every agency that we have, you know, just in hopes that if something happens or, you know, maybe they hire somebody new, our members will get a caregiver. It is a challenge, and I do sympathize with you as well. It's really hard right now.
Yeah, and I think I can just agree and echo the same. We are seeing that across the board as well within our membership. That is a major focus within our care coordinators. And I think just to kind of echo again, we're always trying to reach out within the community or help brainstorm with who else do you know? Is there a church? Do you know, is there like a friend that goes to a church? You know, just kind of those second sort of layers sometimes of contacts or other supports that maybe aren't initially thought of, but yeah, it is a real challenge at this point, especially, and something that we're working on continually every day with our members.
So there have been some questions just about some specific cases for people with Medicare and Medicaid. Again, we don't want to necessarily delve into too many specifics about that here, but I would just suggest that if you have questions, visit the sponsor booths and follow up there. Also, Mary and I have both posted the websites for our respective plans on there. So make sure you go and research those as well. And there would be contact information there as well if you wanted to follow up. I think that covers the questions that are in there. We certainly have a little more time here if anyone has any additional questions.
And also, if anybody wants to share, you know, maybe a nugget or two that they learned today from this session, and ways that you hope to apply it moving forward, you're certainly welcome to do that. And again, we so appreciate the great work that all of you do, and not only as caregivers, but just everything you do outside of being a caregiver as well. And we thank you for taking the time today to be part of this conference.